Which of the following is not proper hand washing procedure? A. Stand back so that clothing does not touch the sink. B. Wet hands with water before applying soap. C. Wash for at least 15 seconds. D. Turn the faucet off with the towel used to dry your hands. Answer, D. Use a clean towel to turn off the faucet to prevent recontamination. Which of the following chemicals should be used to disinfect tourniquets and items contaminated with blood? A. 70% isopropyl. B. 110 dilution of chlorine bleach. C. Hydrogen peroxide. D. iodophores. Answer, B. A 110 bleach solution is effective for disinfecting blood-contaminated items. What is the proper way to dispose of laboratory specimens and contaminated supplies, other than sharps, when following BSI? A. Double bag and throw in the trash. B. Place in labeled biohazard bags or containers. C. Place in puncture-resistant containers. D. Throw in trash that is to be incinerated. Answer, B. Biohazard bags or containers are used for disposal of contaminated items. The manufacturer must supply a Material Safety Data Sheet, MSDS, for A. Fluid-resistant laboratory coats. B. Most patient medications. C. Isopropyl alcohol. D. Isotonic saline. Answer, C. MSDS provides safety information for chemicals like isopropyl alcohol. Which of the following is the most important procedure in the prevention of disease transmission in healthcare institutions? A. Use of personal protection equipment. B. Use of appropriate waste disposal practices. C. Hand washing. D. Reporting personal illnesses to supervisor. Answer, C. Hand washing is the most effective way to prevent disease transmission. A test requires 3 ml serum. The laboratory requires that the amount of blood collected be 250% of the volume of specimen required to perform the test. Which size tube should you use to collect the specimen? A. 4 milliliters. B. 5 milliliters. C. 10 milliliters. D. 15 milliliters. Answer, C. 3 milliliters * 250% equals 7.5 milliliters, so a 10 milliliters tube is appropriate. Normal infant blood volume is 100 milliliters per kilogram. Calculate the approximate blood volume of a baby who weighs 6 pounds. A. 1.2 liter. B. 2.7 liter. C. 270 milliliters. D. 600 milliliters. Answer, C. 6 pounds is almost equal to 2.7 kilograms, and 2.7 kilograms * 100 milliliters per kilogram equals 270 milliliters. To prepare 100 milliliters of a 110 dilution of bleach, add A. 1 milliliter water to 100 milliliters bleach. B. 1 milliliter bleach to 99 milliliters water. C. 10 milliliters bleach to 90 milliliters water. D. 10 milliliters water to 100 milliliters bleach. Answer, B. To make a 110 dilution, mix 1 milliliter bleach with 99 milliliters water. 1 inch is equivalent to A. 1 centimeter. B. 1 millimeter. C. 5 centimeters. D. 2.54 centimeters. Answer, D. 1 inch equals 2.54 centimeters. The civilian equivalent of 1448 is A. 2:48 a.m. B. 2:48 p.m. C. 12:48 p.m. D. 4:48 p.m. Answer, D. 14:48 in military time converts to 4:48 p.m. in civilian time. Unauthorized release of confidential patient information is called A. Assault. B. Invasion of privacy. C. Negligence. D. Violation of informed consent. Answer, B. Unauthorized release of patient information constitutes an invasion of privacy. Which of the following is not part of communicating a professional appearance? A. A clean pressed laboratory coat. B. Long hair pulled back. C. Short clean fingernails. D. Wearing strong cologne. Answer, D. Strong cologne is not appropriate in a professional setting. All of the following are ways to avoid malpractice litigation except A. Regularly participating in continuing education programs. B. Reporting incidents within 48 hours. C. Properly handling all confidential communications without violation. D. Obtaining consent for collection of specimens. Answer B. Incidents should be reported immediately, not within 48 hours. Which of the following examples is a good way to earn a patient's trust? A. Act knowledgeable. B. Convey sincerity. C. Look professional. D. All of the above. Answer D. All of these actions help to build trust with patients. A patient agrees to undergo treatment after the method, risks, and consequences are explained to him. This is an example of A. Implied consent. B. Informed consent. C. Respondeat superior. D. Standard of care. Answer B. Informed consent requires explaining the method, risks, and consequences. What precautions are to be used for a patient who has an enteric pathogen? A. Airborne. B. Contact. C. Droplet. D. Standard. Answer B. Enteric pathogens require contact precautions to prevent spread. What is the proper order for putting on protective clothing? A. Gloves first, then gown, mask last. B. Gown first, then gloves, mask last. C. Gown first, then mask, gloves last. D. Mask first, then gown, gloves last. Answer C. Proper order minimizes contamination risks. What should the phlebotomist do if the outside of a patient's specimen tube has blood on it? A. Discard it after pouring the contents into a clean tube. B. Discard it in the patient's room and draw a new tube. C. Place a biohazard label on it. D. Wipe it with disinfectant. Answer D. Wiping with disinfectant ensures safety without wasting the sample. All of the following are required parts of an exposure control plan except A. An exposure determination. B. Communication of hazards. C. Isolation guidelines. D. Methods of implementation. Answer C. Isolation guidelines are separate from an exposure control plan. The most frequently occurring laboratory-acquired infection is A. Hepatitis A virus, HAV. B. Hepatitis B virus, HBV. C. Human immunodeficiency virus, HIV. D. Tuberculosis, TB. Answer B. HBV is the most common laboratory-acquired infection. 200 ul is equal to A. 2 milliliters. B. 0.2 milliliters. C. 0.02 milliliters. D. 0.0002 milliliters. Answer B. 200 ul equals 0.2 milliliters. 10 cubic centimeters of blood equals approximately A. 1 milliliter of blood. B. 5 milliliters of blood. C. 10 milliliters of blood. D. There is no relationship between cc and ml. Answer C. 1 cubic centimeter is equivalent to 1 milliliter, so 10 cubic centimeters equals 10 milliliters. 1.2 kilograms is equal to how many grams? A. 12. B. 120. C. 1200. D. 12,000. Answer C. 1 kilogram equals 1,000 grams, so 1.2 kilograms equals 1,200 grams. The military equivalent of 1016 am is A. 1016. B. 01000. C. 0116. D. 1016. Answer A. 1016 am is 1016 in military time. A patient voids 1,200 milliliters of urine for a creatinine clearance test. How much urine is this? A. Less than a liter. B. Less than a quart. C. More than a liter. D. More than 2 liters. Answer C. 1,200 milliliters is more than 1 liter but less than 2 liters. Which of the following situations allows the patient to feel in control? A. Agreeing with the patient that it is his right to refuse to have a blood specimen drawn. B. Informing the patient that you are going to draw a blood sample. C. Insisting that the patient cooperate and let you draw blood. D. Telling the patient not to eat or drink anything during a test. Answer A. Allowing the patient to refuse the procedure gives them control. If a physician orders laboratory tests for diagnosis and the patient comes to the laboratory with a rolled-up sleeve, he or she is giving A. Implied consent. B. Informed consent. C. Rightful action consent. D. Preventive consent. Answer A. Rolling up the sleeve implies consent for the procedure. A patient agrees to undergo treatment after the method, risks, and consequences are explained to him. This is an example of A. Implied consent. B. Informed consent. C. Respondeat superior. D. Standard of care. Answer B. Informed consent involves understanding the risks and method. Unauthorized release of confidential patient information is called A. Assault. B. Invasion of privacy. C. Negligence. D. Violation of informed consent. Answer B. Unauthorized disclosure is an invasion of privacy. Which of the following is not an example of possible parenteral means of transmission? A. Drinking contaminated water. B. Getting stuck by a needle used on a patient with AIDS. C. Rubbing the eye with a contaminated hand. D. Touching infectious material with chapped hands. Answer A. Drinking contaminated water is not a parenteral route of transmission.